Hello everyone. Today we shall discuss about first aid. So in nursing or in general, first aid plays a very important role at the time of any emergency situation. The word first aid means first, coming first at the first, priorly, at the most important prior importance is given to it, and aid means help. So the situations in case of emergency that are arising, so at that time of duration, what in general is the priority given of the treatment. So let us look in detail. Let's see the introduction. First aid to sick and wounded has been practiced since ancient times. First aid is not something that has come on recently. This is a practice that has been done since the time of very old. The famous German surgeon General S. March 1823 to 1908 is considered to have conceived the idea of first aid. So in the olden times, in the region of Germany, there was a surgeon whose name was General S. March. He lived from the year 1823 to the year 1908, and it is said that he first developed the concept of first aid or the first treatment that is to be given in case of any emergency situations. But an organized worldwide effort of giving first aid came only in the year 1877. So though the German surgeon had developed the concept of first aid during his lifespan, but the worldwide concept of the first aid came in the year 1877 with the formation of St. John Ambulance Association. So St. John Ambulance Association in the year 1877 decided to develop the concept of first aid worldwide. So here is when the emergency treatment requires the first base treatment, what is to be given, what the idea was given to the people universally. Moving on forward to the definition of the first aid. First aid is the initial assistance or treatment given to a casualty for any injury or sudden illness. So what is it basically? It is the initial assistance, that is the initial help that is given to any person or any casualty scenario that has happened. Or you can say that the first aid is the initial treatment, that is the first step of treating or providing any medical assistance that has been given to the casualty for any injury. That is in case of any injury, what has been given at the priorly or the utmost, or in case of any sudden illness. So it can be whether any casualty is having because of the injury or because of any illness. Now this treatment is been given. When it has been given? Before the arrival of an ambulance, doctor or other qualified person. That is, this treatment is been given in case of any injury or any sudden illness before a qualified person, a medical practitioner, a doctor or an ambulance service arrives. Hence the name has been given first aid, that is what the topmost help that has been given to anyone. The first aid itself signifies that the casualty is in need of secondary aid. Now when we are using the term first aid, what does it mean is that after this prior first most treatment that has been given, the help that has been given in case of any injury, a casualty scenario has happened, any emergency state has been occurred, in case of sudden illness attack that has happened. So after this basic treatment, there is some secondary treatment that is being needed. But before the secondary treatment is being started or the patient has been given the secondary treatment, there is the need for the first aid. And if the first aid has been given at the most vital time, it can be helpful in saving the life of the person that has been affected because of any of the casualty scenarios. The furthermore definitions for first aid can be: first aid is the immediate care given to the injured or suddenly ill person. in case a person is having any kind of sudden emergency situation, a sudden attack, a myocardial attack has been happened to the patient, or the sudden injury has been happened in case of a road traffic accident or any home injury that has been happened. So in those scenario, what is the immediate first step of the treatment that has been given to the person at the site is known as the first aid. First aid does not take the place of proper medical treatment. As this previously discussed before, that in case there is a mentioning of the first aid, it states that secondary aid is necessary. So the first aid or the most important treatment that has been given initially does not take place of the necessary medical treatment that is to be followed for the patient. The main purpose of giving the first aid is you are trying to help the patient or the person who is in the present scenario of the emergency get the appropriate help needed as quickly as possible. It consists only of giving temporary assistance until competent medical care, if needed, is obtained. So when the first aid has been given, the thought that is to be maintained is, other than this first aid, the patient or the person is in need of the secondary aid. And till the competent or the capable medical care is available for the patient, till then these treatment helps in saving the life of the person, and that is to be focused upon as the goal, that is to save the life of the person when you are giving the first aid. So the words that can be remembered in case for the word first aid are, the letter F stands for fast arrival. Fast arrival. Fast means quick, arrival means to come at some place. So the word F stands for coming on time quickly first, that is known as the fast arrival. In case of any emergency situation, the quicker my first aid has been given to the person, the quicker it will be to get the secondary aid for the person in case if the medical help is provided nearby, and in case it can be if it is farther away, first aid can prove as a life-saving treatment that is given for the person. The second letter I stands for intelligent care. The intelligent care meaning the person who is providing first aid to the injured or the person who is suffering from certain illness or any such situation uses their intelligence and the available facilities at its best to provide care to the patient and thereby improve their situation. So after the fast arrival comes the intelligence care, and the use of the intelligence and the tactfulness in the scenarios such as of an emergency is very, very necessary. The letter R stands for recording and reporting. So after the arrival of the persons at the site of the emergency, you need to start recording the scenario that has been happened, and you need to report it immediately so that the secondary medical assistance can be provided immediately. Now the first aid is not the only treatment that is needed for the person at the sign of the emergency. The person needs furthermore treatment. But the importance of the first aid is you can help in relieving the symptoms of the person that has been affected. S stands for safety precautions. The safety precautions are necessary not only for the person who is providing the first aid treatment, but also for the person who is receiving the first aid treatment. So both the person who is providing the first aid treatment and the person who is in need for the first aid treatment need to have the safety precautions so that either of them don't undergo much more harm. In case if the person who is providing the first aid treatment undergoes harm, it will be difficult for the person receiving the treatment to get the much needed help. If the patient who is suffering and is in need for the help of the first aid does not get the adequate treatment because of the harm to the person who is providing the first aid treatment, it can cause much severe complications. The letter T stands for timely action. In case of emergency scenarios where the intelligence and the tactfulness play an important role, based on that, the quickness or the timely action for the treatment is also very necessary. Whenever a person is coming with the complaints of any emergency situation and the first aider is providing the responding treatment to it, if the timely action is not taken, the main goal of the first aid, that is to provide the timely action and relieve the symptoms of the patient, to prolong the treatment provide the treatment for the patient, gets completely hindered upon, and thus the goal is disturbed of the first aid. Moving further, the letter A in the word first aid, the letter A stands for alertness. The person who is providing the first aid needs to be alert at all the time so as to provide and make the quick decisions that are necessary for the time being. If the alertness of the person who is providing first aid is not present, it can cause much more casualties and a more complicated scenario. The letter I stands for initiation and implementation. Now, when the person has arrived on time and the decisions are taken and the timely action is to be done, the implementation of the action is as important as the decision making for which action is to be taken. The letter D stands for the decision making. Now, after providing the initial treatment, the further decisions on providing the next treatment are also to be taken. Calling for the help for the secondary aid also plays a vital role in the decision making. Looking at the aims of the first aid, it can be said that in general, the first aid's aim are to save the life. That is, in case of any critical situation that is arising immediately or out of the sudden, to saving the life of the person that is affected, the individual, or in case of any bigger casualties, the number of individuals is the primary aim. In case the lives are not being saved by the time the secondary treatment or the medical assistance arrives, it can cause in the loss of death for a large number of people in case of larger casualties have occurred in case of a fire outbreak or an earthquake or any such scenarios. The second being to ease the pain. The person who is arriving with the complaints of any emergency situation and in need for the help will be at times in the plot of pain. So in such scenarios, the goal is to relieve the pain of the person. The more quickly the pain is being relieved, the more quickly the person will start to feel comfortable, and it will be a beneficial when the secondary medical help arrives, so them to focus on the other treatment plans. The third aim is to limit the effects of the condition. Now, whenever the person has been affected with a certain situation, after focusing on saving the life, easing the pain, you need to focus upon is limiting the effects of the condition. That is, any more side effects or the complication to arise from the present situation that has been. So in this scenario, the alertness and the intelligence of the first aid provider plays a very important role. To promote recovery. So recovery is a very essential aspect, and promoting the recovery for the patient has to be one of the other goals, along with the saving the life, easing the pain, and preventing the complications of the present situation. To prevent conditions that might increase the original injury. Certain times when adequate care or precautions are not taken, the present scenario gets much more complicated and dangerous than it already is because of the not adequate precautions that are taken, and so patient and the first aid provider are at a much higher risk for their lives. To arrange for transportation to the hospital. When the first aid treatment is provided, the patient will be in need for the much more complicated scenarios that are to occur. For that, the secondary medical treatment is needed. So for that, assistant has to be called. So for the assistance to be called, after the timely action that has been taken, the first aid responder needs to call for the secondary assistance. And these are in general a few of the aims for the first aid, with the emphasis given on saving the life of the person who is injured or under a emergency situation. The objectives for the first aid are to preserve life, that is to save the life, to provide emphasis on providing the care to the person who is injured so as their life loss doesn't occur, has to be one of the most important aim and the objective for the first aid. To prevent further injury and deterioration of the condition. Now, when an emergency situation has occurred or an injury has occurred, the person who is suffering from that is already under a lot of pain and discomfort, and there is no such need to developing of any other more further complications. So, such as preventing of the complication are also one of the more objectives for the first aid. To prevent complications related to injury or illness conditions. For the deterioration of the condition or developing of further more injury is not needed, and hence it is one of the other objectives for the first aid treatment. To make the victim as comfortable as possible to conserve the strength. Now, in case of any injury or any sudden scenario that has happened, that has put the person at the risk for the needing of the first aid and also the much more medical assistance, to providing the comfort to the patient is very much necessary, because there are chances that the person will be in a state of greater discomfort and hence be much more expected to cause harm to the first aid responder and the person himself. If the person does not try to be calm as possible, the first aid person has to be as calm as possible. The next we are going to see is the importance of the first aid. The immediate objective of first aid given at a situation is to save life of an individual. Now, as we have seen in the goals and the objectives, that is preserving the life plays a much more important aspect in the first aid. So similarly, the importance of first aid can be saved as preserving or saving the life of the individual or multiple individuals at case of emergency. The emphasis is given on reducing pain. The patient or the person who is suffering or injured or ill is at a great deal of discomfort, and such deal of discomfort makes the patient less sensitive to the instructions that are being given to them. So the more comfort and more easing of the pain is being done for the patient, there are chances to catch the attentiveness of the patient by the first aid provider, and hence much necessary other informations can be gathered from the patient. First aid should avoid injury. While giving the first aid, it should be focused upon is, other than the present situation that has happened, no more injury or any other complications arise. It should correct situations which tend to increase original injury. The goal of the first aid or the importance of the first aid is that you are trying to correct the present situation, and from that, other than that, no other situations should arise because of the lack of the safety precautions or lack of the timely action. The first aid should form a basis for subsequent treatment by the doctor or hospital staff. As previously discussed, when there is a first aid given, the patient is actually in need for the further more medical assistance, and which have to be provided by the doctor or the hospital staff, and also the planning or the calling for the assistance for the same has to be done. It can be done by supplying details of accident injury or the first aid treatment given. Now when the secondary assistance or the medical team arrives for the secondary treatment that is needed after the first aid treatment has been given by the first aid provider, it is important that the first aid provider explains to the secondary medical assistance team all the treatments that has been given at the first hand and any of the complications or their situations that have arisen and what is the present status for the patient or the persons or individuals or a group of individuals. Now the ultimate aim or the goal or the main focusing point of first aid is the ultimate aim of first aid is to prevent disability or death. Whenever a situation has arisen that puts at the risk of life for the individual, the first aid treatment focuses upon removing the chances of arising of the disability or the death, and hence increasing the chances of the survival for the person. Now, while providing of the first aid, there are certain principles involved. These principles need to be followed or emphasized upon while providing of the first aid to the injured in or any certain illness situation for the individual. The first being acting quickly but with a stable mind, patience. Whenever a situation has arrived and the first aid responders arrives to the site, their patience of the mind is much more needed, because the person who is suffering and in need for the help already is in a great state of disturbance of the mind and the discomfort if they are conscious. So at this time, the decisions that are being taken by the first aid provider has to be with a stable and a calm mind. The more calm the person and the decisions are being taken are more quick, the greater it will be important and much more emphasized, that is, the life of the person can be saved. Taking care of patient in a proper way after knowing the details. Now, after arriving at the site where the first aid is to be provided, the details for the patient situation needs to be known. Always keep near to the patient. While providing the first medical assistance or the first treatment to the patient in case of any situations or the casualty, the first aid responder has to stay near to the patient so as they can continuously observe the patient and check if any other complications or situations arise, and they can be treated promptly. Do not treat the patient in a hurry or in tension. So as our first sentence said, that patience is playing a very important role as a principle of the first aid. In case if the first aid responder is in hurry and in much tension or under the stress or the pressure, and it is visible to the person who is getting the treatment, it can cause a discomfort for the person who is receiving the treatment. So in case of not in being in a hurry and not being tense, but with a calm and a stable mind, the treatment has to be given and the decisions are to be taken. Examine airway, breathing and blood circulation ABC of the patient. Now, when the help is to be given in the form of first aid, the emphasis is to be taken upon the ABCs, that is airway, breathing and the circulations. Let's see. The furthermore important points or the principles while giving the first aid are winning the confidence of the affected person. Now, when the person is in need for the first important medical treatment, they need to have confidence in the one who is giving the treatment. If they find that the person is very much tensed or in a state of discomfort or taking rash, feeling that under pressure, or if they sense that they are taking rash decisions or something, then they won't be much confident in the treatment given to them, and they might cause much more stress to themselves and the person who is providing the treatment. So, to avoid all the situations, winning the confidence of the patient, the person or the first aid responder has to be as polite and patient as possible. Working honestly. Now the person who is injured is at the sole responsibility of the first aid responder, and thus it is the responsibility of the responder to work honestly in providing the care to the person. Don't allow the crowd to gather around the patient. Now this is to be focused upon more is because sometimes after the injury or the certain scenarios of the casualty has occurred, the surrounding crowd can cause a difficulty on providing treatment to the patient, causing suffocation to the patient, or even making the patient feel discomfort and causing the patient under stressful situations. And it can be same too for that situations to occur for the first aid provider, that it can cause great deal of discomfort and stress and cause the person to take rash decisions. So to allow all this not to happen, so don't allow the crowd to gather around the scenario. Now, after looking to the aims and the objectives and the principles, there are certain golden rules of the first aid that needs to be considered. The golden rules of the first aid are quick and careful evaluation of the situation. Now, once the first aid responder has arrived to the site, they need to take the decisions very quickly and very timely. Along with that, the decisions need to be taken with much greater deal of the intelligence. So during this time, the careful evaluation, careful observation of the situation, what has actually happened, what is the thing that needs to be given first priority, which part needs to be focused upon more. These are the certain things that the first aid responder has to focus upon. Give moral support to the patient and their or his relatives. So in the scenarios of the casualty or the injury or any certain illnesses that have occurred which has made the patient to get the first aid treatment, providing the moral support to the patient and along with the patient, the relatives is very much needed, because everyone will be in a greater deal of the despair, and in such situations it can cause rise to further unneeded or uneventful scenarios. So to provide moral support to the patient and the relatives, it is necessary that the first aid responder is in a state of mind in which they can provide the moral support. So other than getting a better idea for the situation, what has actually happened, and comforting the relatives plays a very important role and needs to be done simultaneously and at the focus upon saving the life of the patient. First aid work should be done patiently and calmly. The first important along with the saving the life is the work that is being done needs to be done calmly and with the goal in mind, that is we need to prevent any disability from occurring. Reach quickly to the site of accident. When the person is in need for the first aid, the fast arrival is very much essential, because in certain scenarios the patient will be having a few seconds to minutes of survival chances, and if within this duration they are not given the treatment that is needed, this can cause them their loss of the life. So to avoid such situations, the first aid responder needs to arrive at the site as quickly as possible. To think of the ABCs, A stands for airway is not blocked. Now, as we saw in the principles, that is the ABCs need to be focused upon in the first aid. So, the letter A stands for airway. Airway leading to respiration. It is associated with the respiration. So, in case of any emergency situation, the first aid responder needs to see that the airway or the respiratory tract for the patient is not blocked, because in such scenarios it can cause the suffocation to the patient, and lack of adequate oxygen supply can cause further damage for the patient, and ultimately loss of life can also occur because of the blockage of the airway. So in the ABCs, the airway blockage has not happened is to be emphasized upon. The letter B stands for breathing of the victim is normal. So now when there is a breathing is being taking place, it is normal. There is no any abnormal breathing that is being happening. Such cases of the abnormal breathing, it indicates any of the further more serious situations that can arise or at the present time occurring. The letter C stands for circulation, indicating victim has a pulse. Now checking the carotid pulse of the patient or the injured at the emergency site is very much essential. Why? Because based on that, the furthermore treatment, what is to be given, whether the CPR is to be started or not, or whether more decisions for the secondary medical assistance are what the decisions are to be taken are being decided. So the ABCs during the first aid are: the letter A stands for airway, indicating that the first aid responder needs to check that the airway is not blocked. The letter B, indicating breathing of the victim is normal, indicating there is no abnormality that the victim is experiencing in the matters of breathing. The letter C, indicating the circulation and thus showing that the victim has a pulse, which these play a vital role in deciding the treatment that is to be given to the victim or the injured. So now looking upon the ABCs is, first of all, clear the airway so that the secretions may not be inhaled. Sometimes when the airway is blocked because of any of the situations, maybe because of the secretions, this can cause harm to the patient. Lay down the victim to one side so that the secretions come out. Now when laying down to the victim to the one side, it needs to be considered that the person is not under a major trauma such as any damage to the cervical spine or overall the spinal cord or the backbone or any other critical scenarios. After that, when it is made sure that there is no any further damage or any fracture, then the person or the victim can be moved to the one side so that the secretions are not being aspirated. If breathing is stopped, give artificial respiration. In case if the breathing is stopped, it indicates that the person is in need for the artificial respirations in order to save their life. Thirdly, check for bleeding. Now, if there is any presence of bleeding, it needs to be treated immediately, because if it is not treated immediately, it can cause excessive blood loss in certain scenarios and cause the unwanted situations to occur. Now, after it has been focused upon that the airway is not blocked, the breathing is adequate, the circulation, that is the pulse, is being present or not, and when you are checking for the bleeding, that is there is no any excessive blood loss that is happening at the present time, the furthermore things that need to be checked upon are prevention and management of shock. Because of the certain scenarios that have been occurred at the emergency site, in case there is an excessive loss of the blood, in such scenarios, it can cause a scenario of shock to arise, in which that can lead to the multiple organ failures later upon. If so, in such scenarios need to be prevented, and thus the decision making ability of the person to give the timely action and take the decisions much needed and provide the care much needed are focused upon. Don't give fluids to unconscious or semi-conscious patients, as the fluids may enter his windpipe and cause suffocation. Now, certain scenarios in which that the person or the victim is unconscious, they are not conscious and they are not responding. In case if they are responding partially and are semi-conscious, in such scenarios, no fluids have to be given orally to them. What are the chances is that because of this aspirations can occur and the patient can cause is the fluids entering their windpipe and cause the suffocation, and eventually it can lead to death of the patient or the victim. So to avoid all these complications from occurring, no fluids are to be given orally to the unconscious and the semi-conscious victims. Reassure the patient to stay calm and cool yourself. First aider's calmness may allow victims fear and panic. Now, as we've discussed before, in the scenarios of the emergency, the first aider, the responder, the person who is being providing the treatment to the victim, their calmness plays a very important role, because if they are not calm, they are showing that they are under hurry, making rash decisions, or in the much more pressures and panicking. It can cause a discomfort and fear and panic among the victim, and thus cause furthermore complications and cause rise to the unavoidable scenarios. So the calmness and the presence of the mind for the first aid responder plays a very, very, very important role. And the first aid provider that is being providing to the treatment has to have a stable mind. Keep the victim patient, lying down and quiet. If there is no danger, that is, his neck is broken, turn him to side to prevent choking. Keep them warm. Now, other than management of the shock, the first aid responder that is providing the initial treatment has other roles to do. That includes lying down quiet. Now, if you have to make sure before that the patient is not having any other fractures or any cervical damages or spinal damages. So after this, all things are made sure, it is okay to make the victim lie down and be quiet. Along with these scenarios, the patient should be made feel warm. They shouldn't be exposed to the cold environment or the situations. Because if these situations arise, it can cause furthermore unavoidable situations to take place. Now, not only giving the first aid treatment to the victim is the goal, but informing of the relatives of the person who is being affected also is a responsibility of the first aid provider or the responder. So, informing the relatives of the patient or an accident victim so that they are aware about the situation that has occurred is also very much essential. Arrange to shift the patient in a nearby hospital. Since the first aid treatment is not the only treatment required and the secondary medical assistance is required, so shifting the patient to the nearby hospital is also very much needed. Avoid asking too many questions. Sometimes what happens is the first aid provider or the responder, instead of providing the much needed treatment, tends to ask much more questions so that they can make the much more needed decisions. But this can cause their survival chances for the patient to be greatly reduced, as it causes the loss of the time, as the time is wasted in asking multiple questions that are not needed. Yes, asking questions about the patient's status is needed, but along with that, the timely action to save the life of the patient is also very much needed. Don't allow crowds to come near the patient. Sometimes when the crowd comes near the patient and the victim's side, it can cause harm to the patient more. And these situations are completely avoidable, and they cannot be occurred because they shouldn't be occurring, because the focus of the first aid is to saving the life of the victim. So crowd should not be gathered around the victim. Now we were discussing about the aims, the objectives, the first aid's principles and the golden rules, that is focusing on the saving the life along with the easing the pain, calling for the secondary assistance that is needed. Now apart from this, what needs to be focused upon is the concept of emergency. Where did the emergency came from? Where did the providing of the immediate treatment to the injured came upon? Let's look. In the 1970, the French began to transport wounded soldiers so they could be cared for by physicians away from the scene of battle. So in the previous years when the wars would occur, specifically in the year 1970, the French people, when their soldiers were injured, they started to send their injured people to the physicians or the medical help that was available far away so that they could get the much needed treatment. This is the earliest document emergency medical service. So the emergency medical service is being documented as early as the year 1970. During World War I, many volunteers joined Battlefield Ambulance Corps. So now during the World War I, when the entire world was in a state of the war, the large number of casualties were occurring, and during this time many volunteers started to show up. During Vietnam War in the 1960s and 70s, medical teams produced advances in the field care for trauma. Now during the Vietnam War that was occurring in the 1960s and the 70s, the medical treatment that was given to the injured was played more emphasis upon, and thus the medical teams provide great advances for the team. So the emergency medical treatment that has been given to the injured dates as late as the 1970s has been documented for the emergency medical services that are being provided. Initially, it was done by sending the injured to the physicians far away to get the much needed help during the war by the French government. During the 1960s, the development of the modern emergency medical services system. So when the year 1960 came, the emphasis for the development of the emergency medical service system was laid upon. The concept of ambulance as a means merely for transporting the sick and injured. Now till now, emphasis was placed upon was that the injured needs to get some quick help. Now, this emphasis was changed upon that the ambulance can be used for transporting for the person who are sick and injured started showing up. The emergency medical department was extended through the EMS system to reach the sick and injured at the emergency scene. So now the hospital emergency department was now extended through the EMS to reach the sick and the injured at the emergency scene. In the hospital, there is an emergency department available. Now, when this sick and the injured people are not able to quickly reach the hospital department, emergency department, the hospital emergency department services are now being provided to the sick and the injured at their site, and the ambulance is being used solely for the purpose of transporting of the sick and the injured. Victims become patients, receiving pre-hospital assessment and emergency care from highly trained professionals. Now, before arriving to the hospital emergency department, the persons who are victims or the injured people are getting the much needed assessment and the evaluation and the basic care being given to them, so that on their arrival to the emergency department, the further more complicated aspects of the care that are being needed can be provided. The ambulance attendant was replaced by the emergency medical technician EMT. Now, when the emphasis is being focused upon the assessment and the evaluation and providing the basic care needed, the ambulance attendant was being shifted into a person that is known as the emergency medical technician, so that the much needed services for the injured can be provided. So now let's look upon the components of the emergency medical service system. So the components focus upon as such. First comes the patient who has arrived at the site of the emergency with some need for the help. They come in contact for the members of the public. The public becomes aware of the scenario that has occurred, and they see the patient who is in need for the help and the need for the medical assistance, and they call the dispatcher or for the help They call the numbers that are the helpline numbers available worldwide differently in the different countries for the help. Now, it can give to the responders and the emergency medical technicians that are available. Now, either the responders arrive, and if the emergency medical technicians that are arising, they contact the emergency department staff later on, and thus the elite staff of health staff of the hospital plays now an active role when the patient reaches the hospital department for the further treatment. Now, the levels of the EMS training. There are 4 general levels of EMS training and certification. These levels vary from place to place. Now, for the EMS training and the certification, there are 4 levels. Now, these levels are changing according to the different countries and the different requirements. So, let us see. The first responder. Training is designed for the person who is often first at the scene. The emphasis is on activating the EMS system and providing immediate care for life-threatening injuries, controlling the scene and preparing for the arrival of ambulance. So now the first aid responder focuses upon is activating of the emergency services. So the emergency treatment or the immediate care that is needed to save the life of the person, the first responder focuses upon these things. Now, other than this, controlling the scene and preparing for the arrival of ambulance are also something to be focused upon by the first responder. That is, controlling the scene is getting a grip over the situation and controlling the main problems that the patient is experiencing, avoiding the crowd to gather, along with that calling for the assistance or calling for the secondary help needed, and thus providing a way for the ambulance when the care arrives plays as an important aspect for the first aid responder. Now, the EMT basic in most areas is considered the minimum level of certification for ambulance personnel. Now, the ambulance personnel requires an EMT basic qualification in certain areas. EMT Intermediate, as EMT 1 is a basic level EMT, that is the emergency medical technician who has passed specific additional training program in 3 days to provide some level of advanced life support. So now, other than getting a grip over the situation and calling for the secondary assistance, now other works that can be done by an EMT intermediate are initiation of IV lines, advanced airway techniques, and administration of the certain medications. So the EMT intermediate can go under the certain qualification trainings are for the initiation of the IV lines is there, advanced airway techniques, and administering of the certain vital medications can also be trained for. Now, an EMT paramedic. It includes or equals National Standard Paramedic Curriculum. So now, according to the National Standard Paramedic Curriculum, the EMT paramedic has been certified and trained for. Paramedics can generally perform relatively field care, including insertion of endotracheal tubes, initiation of IV lines, administration of a variety of medications, interpretation of ECG. Now, the EMT paramedic can focus upon is association. They are trained in the field of the care. So, administering of the endotracheal tube is there, insertion of the endotracheal tube, administering of the IV lines, administering of the variety of medications, and taking and the monitoring of the electrocardiogram can also be done by the EMT paramedic. Now, there are certain roles and responsibilities of the emergency medical technician basic. So, looking at the roles and the responsibilities that they come under them when they are dealing with the victim at the first hand are: the person is responsible for a wide range of activities. That is, their emphasis needs to be focused upon that there are a wide range of activities need to be done when they are arriving at the site. And these activities which needs to be done first based upon their decision-taking ability. The person technician responsibilities will include preparation for response, a safe response to the scene. Now, their persons have to focus upon a safe response to the scene. Along with that, some preparation for the response or the care that is been given to the victim. Safe transportation to the hospital. So transporting the victim after providing the basic care to the hospital so that they can get the much needed certain treatments further on, secondary assistance also is one of the responsibilities. Transferring the patient to hospital personnel for continuing of care. Now when they are transporting to the hospital, giving the hospital personnel to chance to provide the much needed care is also the responsibility. So transferring the patient to the hospital so that the personnel available at the hospital can give the much more detailed care that is needed for the victim. So qualities of the first aider. The person who is providing the care, that is the first aid, there are certain qualities that the person should have. So let us look upon the qualities of the first aider. The first being observant. In any emergency situations that are arising where the decisions need to be taken, observation has to be the key quality of the first aider who is providing the basic care. Tactful. That is, the person needs to be tactful as an important quality of the first aider. Resourceful. Making the best use of the resources that are available to them so as to save the life and also provide the much needed vital care or the treatment to the injured is another quality of the first aider. Explicit and discriminating. That is, the explicit and the discriminating aspects. Let us look in detail. Observant. Noting the cause, signs of injury. Now, when the responder is or the first aider is arriving at the emergency situations, it is very essential that they look upon the signs and what is happening around at the situations. And the person who is complaining, what is the complaints of the patient, these needs are to be observed very essentially and is a very vital quality of the first aider. Tactful. Avoiding thoughtless questions and learning symptoms and history of the case. Now, when the scenario is such complicated and the necessary decisions need to be taken very quickly, any thoughtless decisions need to be avoided by avoiding any useless thoughts, and the decisions need to be taken very with much more intelligence. Resourceful. Using whatever is at hand to the best advantage so as to prevent further damage. In certain scenarios, the much needed as resources won't be available. So to make the best use of the resources that are available is one of the other quality of the first aider. Explicit. Giving clear instruction to the patients and advice to the assistant. When the first aid is been given, the clear instructions need to be given so as the quick treatment and the necessary treatment the victim requires are being needed is being provided. Discriminating. The first aider must decide which of the several injuries should be given attention. So, the patient who is having complaint of the multiple injuries, so the patient needs to be discriminated that which are the vital one and focused upon more, and this is another important quality of the first aider. Now, let us see much in detail the specific areas of the responsibilities. They are the personnel safety, the safety of the crew, patient assessment, patient care, lifting and moving, transport, and transfer of care. Let us see them. So when you are focusing upon the transferring of the care, transfer of the patient, patient assessment, so what you need to be doing is obtaining the data from the patient. During the patient assessment, you are going to be doing is obtaining the data from the patient. So when you are doing the assessment so that the further decisions can be taken and the further care can be provided, so you're going to be asking questions. The questions that can be asked are, it possible a brief history of the accident or illness is taken from the patient or the person accompanying him to the emergency department. So now when the person is being accompanying the person, if someone is present along at the victim side who is going to be accompanying them to the emergency department, they can be asked about the questions, or if the victim is conscious, he can answer the questions. As a part of the history, the following questions should be answered. What were the circumstances, forces, location and time of the injury? So taking a detailed history such as a superficial history can be obtained when there are chances that the detailed history can be not obtained. So you can ask is what was the time of the injury, how did the injury takes place, and what else happened. So now the next questions that can be asked is, when did the symptoms appear? So after the injury or the sudden occurrence of the symptoms, the question can be asked for the patient assessment is, when did the symptoms starts to appear or show up? How did the patient reach the hospital? What was the health status of the patient before the accident or illness? In case now the patient has been arrived to the hospital, they can be asked how did they reach, and other than that what they can be asked is health status of the patient before the accident or the illness. Is there a past history of illness or past admission? So if there is a patient, when they can respond, they can be asked about a past history or the past illnesses. Does the patient have any allergies? When was the last meal taken? Now the allergies and the meal taken play a vital role in case of the administration of any medications or the analgesia. These aspects need to be considered. Is the patient taking any medications? What was the date of the patient's most recent tetanus? The tetanus shot is essential for certain times, and other than that, any medication that the patient is currently taking, so that they can be aware if there is a chances of the bleeding that cannot be controlled or any other further more complications, they can get a better idea for the same. So looking at the other than the patient assessment is the personal safety. So the safety of the first aid provider and the person who is receiving the first aid is very much essential. So it can be as, safety is an important aspect for the care provider. Safety concerns include dangers from other human beings, animals, unstable buildings, fires, explosions and others. Now not only the person who is providing the care but who is receiving the care as at a risk. So in those scenarios, they need to be protected from any surrounding situation, the human being, if it is a forest area, the animals that are present, or in case of any earthquakes that has occurred, any explosions that have occurred. So in these scenarios, the safety of the individual providing care and the individual receiving care is very much essential, because in case if the person who is providing the care gets any injury, so then who is going to provide the much needed medical assistance to the victim that is in need for the care? Safety of the crew, patient and the bystanders. Now along with the person who is just directly in contact with the patient and providing the care, the crew that is present, that is the bystanders that are being present, they need to be controlled so that they don't cause any more further damage to the situation. Now the patient assessment. In that, to provide appropriate care, a proper assessment must come first. Now when you're assessing the patient, the aspects or the history taking points that we discussed priorly, that is how the scenario occurred, any medication that the patient is on, what was any other dosage or of the treatment that has been given. These are the things that need to be focused upon during the patient assessment, and along with that, any more present signs or abnormalities that are being seen in the patient right now, that need to be focused upon. Patient care. The actual care required for an individual patient may be ranged from emotional support to life-saving, CPR, that is the cardiopulmonary resuscitation, and defibrillation. Now when you are doing the patient assessment, the first aid responder gets an idea of the care that is to be given. So it can be as basic as an emotional support that the patient is in need of, or it can be as critical as a life-saving method such as the cardiopulmonary resuscitation and the defibrillation. So these things need to be focused upon and can be attained when the patient assessment has been done effectively. Along with this, the personal safety of the individual is also very much essential. Lifting and moving, usually involved in transporting patients to the hospital. Now, after the site of the emergency, when the patient is being called for the ambulance assistance and been shifted, it needs to be focused upon so that no more damage occurs to the patient and further complications arise. Lifting and moving are important tasks. Now, lifting and moving are much more important tasks. The technician or emergency caregiver must know how to lift and move casualty without aggravating or adding patient's existing injuries. Now, without causing damage to the present injuries that the patient is already suffering from, the basic first aid responder needs to focus upon is there is no any additional damages that occurs during the lifting and the moving. So along with the lifting and the moving, the transporting of the patient is been occurring, focused upon is that securing and caring for the patient in the ambulance as well as safe healthcare setting. So now transferring of the patient to the safe healthcare setting, that entire process also needs to be dealt with utmost care. So the transfer of the care, providing the accurate information about the patient's health status and observation of the scene and other pertinent information to the hospital so that there will be continuity of care. Now, when the first aid responder have done their role, they have provided the basic care, called for the assistant, they have lifted and moved the patient very safely, transported them to the medical department or the hospital emergency department, the data that the first aid responder has obtained needs to be further on given on to the emergency medical health provider in the hospital so that the continuity of the care and further planning for the medical assistance or the care can be given to the victim. Now there are certain principles in the emergency management. So let us see. Maintain a patent airway and provide adequate ventilation, employing resuscitation measures when necessary. As we saw before, the ABCs, that is the airway, breathing and the circulations. So these aspects need to be focused upon with the utmost priority while providing the emergency medical treatment to the victim. Assess for chest injuries with subsequent airway obstruction. In case of any more complicated injuries or the serious injuries, focus upon the chest injuries and the blockage of the airway is to be looked upon. Control hemorrhage and its consequences. If there is an active bleeding that the patient is undergoing through, you have the first aid responders role plays is what? Controlling that hemorrhage, if there is an internal or the external, and also the consequences that can arise because of the same. Evaluate and restore the cardiac output. So restoring of the cardiac output is also another priority. Prevent and treat shock. If the shock situation is being arising, preventing it before it occurs and treating it is also very essential. The further are carry out a rapid initial and ongoing physical examination. The clinical course of the injured or the seriously ill patient is not stable. So, a continuous physical examination needs to be done so that the health status of the individual is being looked upon. Assess whether or not the patient can follow commands. Evaluate the size and reactivity of the pupils and motor responses. That is, the size and the reactivity of the pupils and the motor responses need to be seen. Start ECG monitoring if appropriate. Now, other than the physical examination, checking the reactivity of the pupil and monitoring for the ABCs, that is the airway, breathing and the circulation, if the ECG monitoring is needed, has to be started. Splint suspected fractures, including the fractures of the cervical spine in patients with the head injuries. In case if there is a cervical fractures, they need to be splinted, or along with that, if there is any other fractures that have been occurred, they need to be splinted. Protect the wound with sterile dressings. Do not let the wounds to be exposed to the open environment, and the wounds need to be protected with the sterile dressings so no more further infection or the chances of bleeding from the wound site can take place. Check to see if the patient has a medical alert tag or any similar identification designating allergies. So, the medical tag of the patient has to be seen so that they can be indicated that the patient is having any existing problems or any allergies. These are the things to be looked upon. Start a flow sheet of the patient's vital signs, blood pressure, neurological status to guide the decision making. So, the patient's vital signs, the blood pressure and the other requirement need to be noted upon and recorded at the regular intervals so that any fluctuations can be monitored and treated quickly. So what are the goals of the emergency medical treatment? So preserve life, prevent complications, restoring health. So preserving the life of the victim and restoring the health and preventing the complications are the goals of the emergency medical treatment. Now, preserving life, preventing complications and promoting health can be achieved by a rapid but calm approach. So, these objectives are achieved by a rapid, that is a quick approach. But when it is quick, it does not have to be any rash but a calm approach with a stable mind. A quick assessment of the situation and the causality. A quick assessment and the observation of the scenario that has taken and the victim who is being affected. A correct diagnosis of the situation, using of the intelligence and the tactfulness to take a perfect diagnosis or the quick diagnosis of the situation. Immediate and appropriate treatment of any conditions diagnosed. Now, after the correct diagnosis being made, planning of the quick treatment that is to be given so as to save the life needs to be carried upon. So this was the aims, objectives, importance of the first aid along with the concept of the emergency.